My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the Expect Miracles podcast, we have a very special guest, Dr. Amy Pruszenski.
That's correct.
Dr. Amy is a neurodevelopmental optometrist out of New Hampshire, correct?
That's correct.
Dr. Amy, how are you today? It's such an honor to have you on.
I'm very well, and it's a pleasure to be here.
Absolutely. So, Dr. Amy, where are you from originally?
Maryland.
Maryland. Okay. And what were you into growing up as a kid?
I was going to be an engineer like my oldest brother, the genius engineer at MIT. So everyone spoke with such reverence. I decided that was a good thing to do, and everyone was very supportive and got all the way to MIT and realized, oh no, I am not an engineer.
Really?
Yes.
What was it when you got to MIT that you were just like, this isn't for me?
Oh, I'm sure it was probably thermodynamics.
Yeah. So did you end up staying at MIT?
I did. So I fortunately procrastinated applying for a work-study job, and I couldn't afford to be there without a work-study job. And my randomly assigned advisor created a position in his lab doing vision research. So I fell in love with cognitive science and brains and eyes and how it all worked together. And this is back in the mid-'80s when neuroplasticity was just beginning to be accepted in the neuroscience field.
That's pretty amazing that that field was almost just like gifted to you.
Accidentally. Yeah, God works in mysterious ways, I think.
And from what I remember, you talking at the Blair conference, you definitely did you have vision issues or just health issues in general? Can you go into that a little bit?
Absolutely. I had a lazy eye, which I had totally repressed and forgotten about. So my eye would turn out toward my ear. And so even the pediatrician could figure out something was wrong. And I just got lucky that the doctor rotating through the Navy Eye Clinic at the time not only did patching and glasses, but taught my mom how to get both eyes working together. And so my eyes are straight non-surgically.
Wow. Mm-hmm. Do you recall what they did to make that happen?
I don't remember. I think it was torture back then. The whole patching thing, I hope, is declared.
Grabbing the eye and pulling it back.
Oh, it was just, no, there's no surgery. It was just, doing exercises and showing my brain where the error was so my brain could recalibrate, basically. So in the old days, we thought there's a good eye and there's a bad eye. And so we're going to tie up the good eye, patch it, and let the other eye get stronger, which it does. If you don't have a choice, your brain will get that eye good for detail. But if you untie the bully eye, it's going to take over again. And so what really is happening is your brain is choosing to park the eye over to the side because you haven't learned how to get both eyes working together. So if we instead teach the patient how to get both eyes working together, it no longer needs to be parked off to the side.
Beautiful. Mm-hmm. So Dr. Amy, tell me a little bit about your first vision internship or eye internship that was set up for you.
So basically, I've had to seek out education on my own. When I graduated from MIT, thank God, my advisor suggested going to optometry school rather than getting a PhD because I'm too much of a people person. Being stuck in a lab the rest of my life would not have worked well.
Right.
And so this way I have the flexibility of teaching or seeing patients or doing research. And so I went to optometry school and they made me an eyeball doctor. We very much in the old days had more of an eyeball model of vision. Thankfully, that's beginning to change with the neuroscience research coming out. But I very much was taught about ocular disease and eyeball problems as if the vision's in the back of the eyeball. The retina is part of our brain. And so it's not as simple as just getting the image clear on the back of the eye. We do need a healthy eye, obviously, but we need to make sure the connection between the eye-brain is working well and that the brain is using the information from the eyes well and directing the eyes well.
Now, you were trained as an eyeball doctor. What made you go outside of that paradigm shift and figure out that the brain was just running more than we thought?
Essentially, I opened my practice and I thought, yay, now I can help other children like myself get their eyes working together and help them with their reading and other skills that are required using the eyes. And sent letters to all of the school nurses, and they all said, oh, thank you very much. We've got this ophthalmologist we work with, who is more of an eyeball doctor in general. And I'm obviously simplifying it for the audience. And so I realized, okay, we can't ram it down people's throats. So I became an eyeball doctor and did basic exams and checked for eye health problems. And then over time, I would find patients who have these binocular skills issues, trouble getting their eyes working together, and I would treat them. And so we started getting patients who were getting better. And the occupational therapists actually in the schools were the first ones to notice this and begin to send more patients to me as they found patients having trouble with eye coordination. And so the practice gradually grew. And then I had no intention of being a brain injury expert. I knew it would be difficult and I knew it would be much more brain than eyeball and was a little afraid of it at first. And when the occupational therapists at the local rehab found out I could do vision training with the children, suggested, won't you just see this one brain injury patient?
Really?
And that was all it took. Yeah. So any one of us could slip and fall on the ice or have a car accident or have an aneurysm or something happen. And I realized this could be me. This could be my loved ones. This could be anyone on the street. And I had to learn more about how to help them because the vision is a big piece of what our brain uses. And so I sought out education. The optometric extension program is one of my core linchpins of what I've learned. And I found Dr. Deborah Zielinski out in Chicago through the book her patient, Clark Elliott, wrote about his concussion and how she helped cure him after 10 years of suffering.
Wow.
And so I realized this woman knows how to do things with lenses and prisms and tints that I don't know how to do, and I need to learn it.
That is so beautiful. So the majority of your patients are brain injury patients?
These days, yes, because there's so few of us doing this work. So I rarely do a normal regular eye exam anymore. There's so many doctors who can provide that service to the patients. So I have a lot of optometrists send patients to me, physiatrists, neurologists, the occupational therapists, anyone involved in the rehab team basically understands now the importance of the vision and how I can help using the retina as part of the brain to get the brain working better and feeling more comfortable. And so I'm a part of the team now.
Beautiful. Dr. Amy, can you run me through what exactly the rehab process is like? Every patient a little different where you have to tailor their own exam findings to that patient so you get the results you want?
I imagine it's similar to your work where all of the patients have similarities. There's something called post-trauma vision syndrome where we typically expect to see people having trouble getting their eyes to converge and they have light sensitivity and dizziness and headaches and various other issues like that, balance problems. Many times their perception of straight ahead is now skewed because the brain is getting bad information. Everything we perceive around us is an illusion our brain creates. And so if the system is working well, we get an accurate, roughly, impression of what's around us and how we're moving and how other things are moving around us. When we have an injury, we get bad information because now the eyes aren't coordinating accurately. And now we get the problem of we're drifting sideways down the hall and we think we're going straight, or we're dizzy, or we think the ground is not flat, or whatever other perception our brain is creating based on what it's getting. And that's what we want to help recalibrate. It's more what I call the where visual system. Where am I? Where are you? Is the ground flat? Am I moving straight down the hallway? Where's the next word? All of these things are more of the where visual system versus the what visual system. All of us are familiar with the, 20/20 is good vision. And
Right.
so what you're seeing on the eye chart isn't necessarily affected in a head injury. I have plenty of patients who can tell me letters on an eye chart, but they can't function in life.
Absolutely. Now, you just mentioned recalibrating the brain and the eyes. How exactly do you do that? You mentioned prisms and all of that. Can you walk us through that?
Yes. So one of the main things I've learned from Dr. Zielinski is the retina is part of the brain. And literally by manipulating how we hit the light on the retina, even through a closed eyelid, we can manipulate how the brain perceives things and where it thinks things are. And so one of the first things that I'm looking at is, can I come up with a lens, a prism, a tint, an occluder? I can even block light from part of the retina to stimulate different parts of the brain to give the patient comfort and get things calmed down so they can now work on healing. You can't even begin to heal if you're stuck in your sympathetic nervous system and you're in your fight or flight mode all of the time. And so we want to get more to the parasympathetic rest and restore mode to get things working again. And then at that point, we might teach some basic exercises to show the brain, this is what's going on. You think this is what's happening, but this is what's really happening. So your brain can work on recalibrating it. Not all patients are able to do that right away, depending on how severe the injury is.
Absolutely. So you probably have patients that tend to heal up pretty fast, and then you obviously have the patients that it takes a little bit longer. How often do you have to reassess and readjust the prisms to keep the healing process going?
Well, it takes 3 months to get in with me, so we almost don't have a choice as far as how often the follow-up can occur. There are some patients I'll try to squeeze in sooner, or we can be a little more flexible with the timing. But for the most part, people see me once every 3 months. Now, some patients are able to do more of a home-based program where I teach them things to practice. Their loved ones help them, or an OT can help them. They go practice it, and then they come back and I give them new things to practice. Other patients really in a more severe situation or we're not getting the results we're expecting, I might have come in and work with one of my vision therapists once a week or once every other week, and then still get home things to practice. The home practice is key, just like learning any other skill. I could have the best piano teacher in the world or the best baseball coach or whatever, and if I don't go practice what they give me, I'm probably not going to learn the new skill. And so that repetitious practice is what makes the new brain pathway, but we have to figure out what do they need to practice and tweak it depending on their situation.
So that's very interesting. You work with a team of vision professionals. So is it first and foremost, do you see the eye exam, see what's going on with the eyes? And then how soon do you pass them on to your other team for the vision therapy? And do some people not need the vision therapy right away?
Some people can't tolerate the vision therapy right away. These are the people who come in and they're wearing like 2 pairs of sunglasses and dark, brimmed hat and can't tolerate any light or movement. And they're really in a torturous situation. So we have to get that under control first. Other patients are moderately functional, but they're suffering. And so often at that first visit, I'll prescribe therapeutic lenses to help their brain function a bit better and get things working again. And then we'll also give them some simple exercises to practice. So I usually have one of my technicians or assistants teach them the exercises so that I can move on to the next patient so we can see more people.
Beautiful. Now, you also work with a couple Blair upper cervical doctors, Dr. Michael Beebe and Dr. Tyler Evans. How does the two systems work together, and has it helped your practice get more people better by sending the upper cervical work and the vision specialty?
Yes, I was a fan of chiropractic care in general because my chiropractor cured my vertigo 20 years ago. So I went to ear, nose, and throat testing. I was told I was fine. I said, okay, that's great, but I'm on the floor and the room is spinning. And then I had an MRI, which was negative, thank God. And my general chiropractor, thank God, finally figured out my C5 was out. And so I was already a fan of chiropractic. And when Dr. Evans and Dr. Beebe moved into town, they connected with me just to let me know that they were here and what they do and how it's a little different. And so we've had a number of mutual patients where the way I look at it, and you can correct me if I'm wrong, I feel that the brain is what controls all of our body and then gets information from our body to figure out how to do things. And so if there's a roadblock in the neck, you've got trees down in your highway. And so you may be getting cars around those trees, but it's not efficient and it causes problems and you may get miscommunication. And so if the upper cervical chiropractor is able to get that cleared for me and we're getting waste products out of the brain and getting nutrients into the brain and getting those signals clear and easy again, now I can make more progress with what I'm doing and the patient in general improves better.
That's a perfect analogy. And it definitely also works vice versa. I'm sure they are thrilled to have you to refer to because we do still have people that maybe the vertigo gets better, but the brain fog and other vision problems are still there. So it is just phenomenal to have another specialist to refer out to.
I do think it needs to be a team effort. So one of the things I also recommend is Kevin Ballister has a book called How to Feed a Brain. So we have the nutrition aspect of high fat, low carbs, get rid of the inflammatory foods, gluten, sugar, and dairy. And the patients often make much, much more progress then because we've stopped throwing gasoline on the fire, essentially. Once they're under control, then they can gradually reintroduce foods and do better. But I do think nutrition is a piece of it. The cervical health is part of it. The visual health is part of it. OT and PT have their role. So there are a number of different professionals that I think are required in certain cases. And it's just a matter of figuring out who needs to be on the team and who can I trust that gets good results.
Absolutely. So Dr. Amy, I have a question for you. What is going on with the eyes that might be causing migraines or blurred vision or dizziness that you can just correct with prisms and it goes away and resolves? How does that work?
So there are a couple of ways of looking at it. Sometimes the eye coordination is challenged. And so again, the brain thinks the eyes are aiming in a certain position, but they're not. So the input the brain is getting is off. And so we sometimes use prism to redirect the image so that the brain can get the eyes working together more easily. But on a deeper neuroscience level, what Dr. Zielinski has figured out literally is, again, we can redirect light to different parts of the retina to stimulate different parts of the brain. So in some cases, I want to stimulate a part of the brain that's healthy that can take over for a damaged part. In other cases, I want to stimulate the damaged part so it can get stronger again and improve. So it just depends on what was the injury, how severe is it, what else is going on. And so that's half the trick of it. And I'm not perfect at it. This is one of those things I've studied with Dr. Zielinski for 2.5 years now, and she's certainly at a very high level. She's been going to the neuroscience conferences for 25 or more years now, so she's able to do things much more quickly than I can. I can usually get pretty good results, but it takes me longer and I have to think it through a bit more.
Absolutely. And I'm sure your field is still discovering some phenomenal new things every year that changes the way you treat people.
I've started going to the Society for Neuroscience meeting again with Dr. Zielinski in the last few years, and it's overwhelming. You've got 15,000 researchers presenting their research in a 5-day period of time. And so some of the work is on Parkinson's and Alzheimer's and dementia, which is another huge public health concern. Some of it's on TBI, other developmental issues. So it's a lot of information that's coming fast and furious. So we live in an amazing time where it's the hot topic. And so we have lots of research that's being done and getting more information all the time so we can do a better job.
Now, was your treatments available like about 15 years ago, or is this like a pretty much recent 10 to 5 year?
Well, I think the answer to that question is Dr. Zielinski's been developing her techniques for decades now. And she attempted to help people become aware of it, but I think the profession of optometry wasn't ready for it yet.
Right.
One of those things where when neuroplasticity was still early on, a lot of people were still skeptical. There are people skeptical now. And so we had a much harder time accepting some of the concepts. This whole idea of, she has a Z-bell technique, which helps integrate the auditory and visual processing together better. We use closed eyelids. We're using light through those closed eyelids and manipulating it with different lenses, and people just can't wrap their heads around, my eyes were closed. But just as if you're out camping and the sun comes up, you can't see anything, but your body knows to wake you up because it's responding to the light.
Wow.
And we're using that light to manipulate how the brain is working. And so that's one of the newer things that I would say within the last probably 5 or 10 years, certainly since Clark Elliott's book came out, The Ghost in My Brain. People around the world now want to seek out Dr. Zielinski because she cured him. So there's hope now, where people have been told by some professionals they will not get better. It's been too long after their injury, and this is, get used to the new normal. And so thankfully, you don't necessarily have to. I never guarantee perfection or pre-injury status, but I can usually guarantee improvement. I can usually give them better than what they've got when they first come in the office.
Absolutely. And Dr. Amy, it's been a couple times you mentioned neuroplasticity. For those listening, what exactly is that?
Oh, so the idea is that in the old days, we thought the brain is hardwired. It is the way it is. And so you are the way you are.
There's no healing. There's no new neurons being developed.
Exactly. And so neuroplasticity simply gives us the idea that, of course, you can change the way the brain is functioning. You can change the way it's wired and improve things. And if you think about it, the way I look at it in simple terms is, it would be like saying someone my age can't learn a new foreign language because I'm past the critical period at which I would normally learn language when I'm 5 years old. I can still learn a foreign language. I may have an accent, and it will take me longer than a 5-year-old unless I'm gifted, but I can still do it. Or learn a new sport, or learn a musical instrument or something. So we have examples of neuroplasticity all the time. In fact, what I've read recently is to prevent Alzheimer's, it's not enough just to be active. You have to learn new stuff. So you don't want to just reinforce the existing pathways. You want to develop new pathways. So you might pick up a new sport or pick up a new musical instrument or a language to be able to keep your brain functioning at a higher level.
Keep mentally sharp. That's very interesting. Wow. So, Dr. Amy, it's just very mind-blowing what you do, because I didn't hear about this until you came to the Blair Conference a year or two ago. Where can people find other practitioners that do what you do?
The sources is the Neuro-Optometric Rehabilitation Association, which is NeuroVisionRehab.com, I believe. It might be a .org. But they have a lot of information about brain injury, and that's also a multidisciplinary group where we have OTs and PTs and optometry and ophthalmology and neurology, anyone who's interested in rehab, collaborating and showing what's been working, what's not working, thing. And teach practitioners who work to be more eyeball health, how to help using the visual system. I also recommend Dr. Zielinski's website. It's fascinating, themyconnection.com. She has a lot of information about mind, body, vision connection and how it affects our daily lives and how she can help people.
Beautiful. And so I know we've been talking a lot about brain injury patients. Are there any other type of situations, illnesses that people might seek you out for other than brain injury?
Yes, we take it for granted. When things work well, it's like breathing or blinking. It just happens. We don't need to think about it until it doesn't, and then it can really be disruptive to our lives. And so I've helped patients with cerebral palsy, with Down syndrome, with other developmental issues. I've got people who have had aneurysms or strokes or any condition which can affect our neurological function. There are times I can help using the eyes as a conduit.
Any patients with Parkinson's or Alzheimer's as well?
Yes, I think that you've got a degenerative process going on there. I'm certainly not going to cure the disease, although the interesting thing is the World Brain Mapping and Therapeutics Society is a group of neuroscientists, neurosurgeons. We optometrists are now attending that meeting and presenting at it, where they're pooling their resources. Instead of each lab researching independently, they're all collaborating and coming up with strategies to how do we find answers sooner. And they are looking, thankfully, to Dr. Zielinski's work at the eye, not only for early detection, but as a treatment modality. Can we come up with ways of manipulating light hitting the retina to help either slow down the process or cure the disease? And so that's the hope, is they're working on it. I think we're years off as far as the research goes, but maybe not. You never know when a breakthrough will be hit.
And what type of equipment do you have in your office to help test to see if the light is hitting the retina the right way, if you need to direct it? What kind of measures are you taking to actually fix the problem?
So my office actually looks like a normal eye doctor office. We have the big 4-opter. It looks like a big bug pair of glasses with all the lenses in it and everything. But the key is Dr. Zielinski's bell technique. She's actually patented her bell, and she's got a high-pitch bell and a low-pitch bell, and obviously requires training. And so she's looking at ways of how can we teach optometrists how to do this work and get them certified so we know that they're doing it safely and with proper procedure. It sounds simple, but with the bells, and then I have different filters, different colored lenses that I put in front of people's eyes, different prisms, even the glasses prescription. We think of just get the image clear on the back of the eye, but when I prescribe a lens, I'm looking at not only can they see the eye chart, but how is it affecting the basic functions of the body? It's interesting. She actually is lecturing or has lectured recently to the International Cardiac Society with the cardiac surgeons, because it's light affecting the retina can affect how our heart functions, how our endocrine functions. It's just an amazing thing where I think we're just at the tip of the iceberg, where we're just now learning how we're affecting things. One of the things I've experienced as an optometrist before I got into the most of the brain work was a patient would come back and say, these glasses aren't working. And you would do all your math and you would check the lenses. You say, no, the lenses are fine. Well, yes, if all you're doing is getting the image clear on the back of the eye. And so what most of us are not trained in is, oh my goodness, you could be affecting so many other things. So for example, Dr. Zielinski will talk about a patient who had all these GI issues, these stomach problems, and they went to the doctors who test for that, and they're tested, and just like with me and my vertigo, they're told they're fine.
Yeah.
Well, their tests didn't happen to pick up the problem. And so they'll end up in her office somehow, and she'll say, well, what else happened around the time these symptoms started? And often they've just gotten their new pair of glasses or they've just gotten new contacts. And she'll tweak the prescription.
And that's affecting the gut.
And it's affecting the gut, which is our second brain.
Wow.
Yes. I know, it's mind-blowing. She's really the leading edge neuro-optometrist. I mean, really, I think that she's far and above all the rest of us. And there are many good practitioners in my profession who have pieces of the puzzle. And the thing I respect about Dr. Zielinski is she acknowledges that. Like, she'll acknowledge, okay, this doctor has this piece of the puzzle, this doctor has this piece of the puzzle. And she's trying to encompass it all with the knowledge she has from going to the neuroscience conferences.
Now, Dr. Amy, I have a question for you. This is more of a personal question. In my office, I do have people that go to vision therapy. I have a couple that say, oh, I love it. It's helped me out a lot. I have a couple that say, I felt so much worse after that appointment. What patient, I think you mentioned it before, it's the patient that's got 2 pairs of sunglasses on that really can't tolerate any light. The referral network is just in my office. I'm just trying to think to myself, when is this person ready for this therapy? Is it making them worse? Is it making them better? What are your thoughts on just general vision therapy? And I know that's kind of a blanket statement because you have no idea what these people are doing exactly, but I just want the best care for my patients and when to refer them out.
Exactly. And that's the challenge. I think that all of us have the best intentions. I mean, even the doctors who are more ocular disease oriented have best intentions. They just don't have the knowledge in this particular area. And so I think the reason sometimes the vision therapy works is that doctor has that piece of the puzzle, which actually helps this particular case. A different case may not need that. They may need the lenses, prisms, tints, filters that Dr. Pruszenski can offer. And she's working on it. I am excited to be part of her team where we're working on developing a network of offices across the country for sure, and eventually across the world who will do this technique. But again, the concern is making sure that it's responsibly done. These doctors are certified. They know what they're doing. Imagine it's very much like the upper cervical work that you do with the Blair technique. You don't want someone messing around with it if they don't know what they're doing.
Absolutely. And you have people claiming that they're doing it and they're really not. Yeah.
Exactly. So I think that there are many, many optometrists who are neurodevelopmental optometrists or behavioral optometrists who have a piece of the puzzle and often can help. That's where, like I say, there's a Dr. Locator on Neurovision Rehab site. They've just changed the name of the website, so I have to keep reminding myself what it is. The other website that sometimes is helpful is the College of Optometrists in Vision Development, where they have a Dr. Locator. So at least these doctors are not just eyeball doctors. These are doctors who do study the brain and are at a certain level. But I'm excited that Dr. Zielinski is working to get a bunch of doctors certified as quickly as possible, but as responsibly as possible, who can do her work and carry on after her eventually. This is hopefully going to change the profession of optometry so that at least it is highlighted subfield within my field that people can choose, just like you might choose to be a glaucoma expert or something else.
That's beautiful. And Dr. Amy, I know it takes 3 months for people to get in to see you, but where are you located? Does your practice have a website? Where can people find you?
Yes. So I actually have 2 practices, 3 locations, because people are driving 2 and 3 hours one way to see me. So I'm in New Hampshire. I'm on the seacoast most of the time, but I do have a satellite office in Concord, New Hampshire at the capital. So one website that is helpful is harboreyecare.com. And that's where I do a lot of brain injury work. We don't have on-site therapy going on, but most of my patients, I'm partnering with the OTs anyway, because there are so few doctors doing this work. I need as many patients to get help as I can. And many times there's a lot of overlap with occupational therapy. I like to say they use the visual system to get the motor system working better. I use the motor system to get the visual system working better. So we're good partners. So often my guys I've worked with for many, many years, sometimes over a decade now, they understand where the line is and what they can do without me and what they need to consult me for, and when they need help with prisms and lenses and stuff. So it's a good team effort. I do have respect for other professions, as you know. Yeah. And I think that if we each contribute our piece of the puzzle, the patients get better faster. So that's my main office. I am still contracted with insurances there. My other office is Visual Victory Training, and visualvictorytraining.com is that website. And I'm not contracted with insurances because most of the time the insurances don't acknowledge what I do. Yes. I think it takes a while for the third-party payers to catch up with things that often are the successful thing to do, but they've got their rigid requirements and criteria that they've followed for years, and they seem to be resistant to changing that. So I negotiate with patients at that office. I've done payment plans. I've done care credit. I've done health savings plans. I've bartered. I've got some beautiful handmade wooden tables from a patient's family that I treated the patient, and they helped me get some tables for my equipment. So it's one of those things where I do what I can to give back. When I was a child, I'm Depression era parents raised. And so you could bring a chicken and have your eye exam, back then. I need a little more than a chicken these days, but I am happy to work with people on getting them the care they need in whatever way that happens.
Amazing. And Dr. Amy, at the end of every show, I'd like to ask all my guests, what is one piece of advice that you would like to gift the audience that's really resonated with you through the years? It could be absolutely anything.
I think that I would encourage patients to understand it, and please take this with a grain of salt, but I tell my patients, you're not dead yet. Once you're dead, I can't help you. As long as you're alive and breathing, we can influence the brain connections that you are making. And so let's try to influence them in a positive direction. So again, I can't guarantee perfection, but please don't give up hope. Please continue to picture yourself well and healthy. Can't hurt, might help, and get practitioners who can give you things that you haven't had yet that might help you with your recovery.
Thank you so much. I really enjoyed this episode. I love your field, and I'm excited. If you find anything cutting edge over the next year or so, please let me know. I would love to have you back on anytime.
Oh, thank you so much. It's been a pleasure.
All right. Thank you, Dr. Amy. Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.